we take our brains for granted. We don't stop to think about what it takes to wake up in the morning, to rouse from that restful sleep, open our eyes and see the light coming in the window, the muscle control that it takes to throw the covers back off the bed and to get up, and to go to the bathroom and do your business, to brush your teeth, wash your face, stumble to the kitchen to get your coffee, decide how much sugar you want in your coffee and if you want creamer, the taste of the coffee, determining whether or not that rumble in your belly means you're hungry, and then what you're going to fix for breakfast. Do you really want cereal or do you want to cook some eggs? And then you cook your breakfast and you eat it, you taste it, you feel the sensation of being full, you go back, and now it's time to figure out what you want to wear today. You remember that you wore a blue shirt yesterday, so you decide you want to wear a green one today. And then you determine what shoes. You get dressed, you put on that cute little pair of sandals to match your green shirt, but they don't feel comfortable, so there's that painful sensation and you take them off. Now, all of that happened before you're even really ready to get your day started, right? You haven't gone out the door to drive, to go to work, to go to school, to do any of the many things that your brain has to take care of each day. This takes billions and billions and billions of neurons and trillions of neuroglial cells to process all this information, to make sense of it, to detect the world around us, and then, of course, to have those actions. So the brain is the control center for registering sensations, then to correlate those sensations, that stimulus, with each other and also with stored information from things that we have already made decisions and learned about. Then we have to make those decisions and perhaps take action. So that's pretty complicated so far, but we hadn't even considered the role of your intellect, your emotions, your behavior, and your memory. The brain directs our behavior toward others. It helps us to form ideas that may solve problems or create art, or to think critically about something someone says to us. Directs the actions that we take because of those thoughts. So there are many different areas of the brain that are specialized for different functions. They process a particular type of information that's coming in. There are other parts of the brain that work together to accomplish several functions by relating something to something else that's stored in the brain. So in this particular chapter, we're going to look at the pieces and parts of the brain, how it's organized and how it's protected. We'll compare and contrast different areas of the brain, what they do. Look at the functional organization of the brain, which is, of course, what they do. We'll look at the cranial nerves, learn just a little bit about their structure, and then we'll learn about some of the really cool things that our brain does in helping us to regulate the sleep cycles and process memories, and the waves that we can see as brain activities change. At the end of this chapter, we'll look at some injuries and some disorders and imbalances. And, of course, then we'll talk about changes that occur from the time we're born until we get old and the end of our life cycle. So we'll begin looking at the parts of the brain. We divide the brain into 4 principal or large parts. The brain stem, you can see here, it is indeed a stem that travels from the inferior part of the brain down through that foramen magnum in the occipital bone and is then going to become the spinal cord. It consists of the medulla oblongata, which is a little bulgy area, the pons, which is a much larger area, and the midbrain, which is above that. I apologize if you hear a lot of background noise right now. I'm at home today and a plane's flying over. Started this over a while ago because, of course, as soon as I get on here to record videos, the phone rings. So my apologies for the noise. All right, let's get back here. So here is the brain stem. Posterior to the brain stem, you can see here, is the cerebellum. Cerebellum means little brain. We'll look at that as we continue through. Superior to the brain stem, so above remember, superior. All of this area is known as the diencephalon. The diencephalon is made of the thalamus, the hypothalamus, and the epithalamus, which contains our pineal gland. And then we have the main part of the brain, which is the cerebrum. So that's the largest part of the brain, and it's supported on the diencephalon and the brainstem. As we've seen already, the brain has a lot of functions, so it's important that it is very well protected. The cranial bones form a covering that surrounds the brain and prevents injury to the brain. Now, we do know that things happen, but under normal conditions, there's a pretty tough covering there. So here, if we look at a section through the brain, you can see the external part, which is going to be your skin and a little bit of the fatty tissue that covers the brain. Then, of course, you can see a layer of cranial bone. So you can see the compact bone on the external surface of that bone that's going to give that protective outer covering. Within the bones, we have cranial meninges. So just like we saw with the spinal cord, the meninges are the same. And in fact, the cranial meninges are continuous with the spinal meninges. They have the same basic structure and the same name: the pia, the arachnoid, and the dura. And they're located just like we saw with the spinal cord, with the arachnoid being between the dura and the pia. The dura, that tough outer layer, is going to be very protective. The arachnoid, very web-like and in the middle. And then the pia, the innermost layer, lying on the surface of the brain itself. The brain is also connected by a colorless, clear liquid that we call cerebrospinal fluid. So it's composed mostly of water, but it also has oxygen and glucose and other chemicals that are necessary for the brain to function, and it provides a cushioning and protection from both chemical and physical injuries. As I just mentioned, the cranial dura mater has two layers, where the spinal dura mater only has one. In the brain, the two dural layers are called the periosteal layer, which is external. Now that should tell you something. Peri, around, oste, bone. So this is the outermost layer that's attached to the skull, and then the meningeal layer, which is internal. So it's going to form that dural sheath in the spinal cord, and the inner layer, of course, of the dura mater are covering the brain. There are certain areas as well where the dura are going to be fused together, and areas where they're separate. So when they're separate, they enclose these structures called the dural venous sinuses, which are simply passageways that drain venous blood from the brain and deliver it back to the jugular veins so that it continues in circulation. Also, a difference between the spinal dura and the brain dura, the cranial dura, there's no epidural space around the brain. There are certain areas of the dura as well where it extends inward and forms partitions or divisions of the brain that help to limit excess movement of the brain within the cranial cavity. So let's look briefly at those. The falx cerebri is right down the center of the brain. So it divides the left and right hemispheres of the brain. So if you look at this sagittal section, this is a mid-sagittal section right down the center of the head. So your dura mater is going to be that outer meningeal layer, and then the dura mater, where it extends down and forms that divider, is called the falx cerebri. In addition to that, there is a falx cerebelli that separates the two hemispheres of the cerebellum. So the cerebellum will be located down here, and you can see a little bit of that falx cerebelli here. And then there is a tentorum cerebelli. So think of a tent. What does it do? It forms a cover. So the tentorum cerebelli is going to separate the cerebrum from the cerebellum. So you can see a little bit of that extending here. So the cerebellum would be located lower, the cerebrum would be above the tentorum. The middle layer of the cranial meninges is the arachnoid mater. Very loose covering, so it allows for a lot of blood vessels to pass through that area. So it's separated from the dura mater by a subdural space. Remember, I said there's no epidural, but there is a subdural space that contains cerebrospinal fluid. There's also a subarachnoid space. Think about what these words mean. Subdural, below the dura. Subarachnoid, below the arachnoid. So below this, there's those web-like extensions that anchor the arachnoid to the pia mater, but also provide that passage area for cerebrospinal fluid and the larger blood vessels of the brain, which include the extensions that are the vessels that come from the carotid arteries and the vertebral arteries, which are the main supplies of the blood. The pia mater, again, just like we saw with the spinal cord, is a very, very thin, delicate inner layer of connective tissue that lies on the surface of the organ. So it lies on the surface of the brain, has a lot of very, very small blood vessels, and it clings very tightly to the surface of the brain. So very much like a thin saran wrap that you might wrap a piece of food when you put it in the refrigerator. And this is how you see it when you do the brain dissections in lab as well. So it clings very tightly to the surface of the brain, and it follows or lies on and clings to the bumps and the bulges and the grooves that we'll talk about with the brain. So let's think briefly about the importance of getting that blood to the brain. So blood flows, as I mentioned earlier, mainly to the brain through the carotid arteries and the vertebral arteries. The dural venous sinuses, venous means vein, okay? Sinus is an enlarged area. So the dural venous sinuses drain into the jugular veins to return that blood from the head back to the heart. So the carotid arteries and the vertebral arteries take it up. The venous sinuses then drain into the jugular veins to return that blood back to the heart. In an adult, let's move on to the next slide. Okay, in an adult, the brain takes up only about 2% of total body weight, but it consumes about 20% of the oxygen and glucose used by the whole body. And this is even when you're resting, so imagine when you're active. The neurons, or the nerve cells, do synthesize ATP exclusively from glucose, though. So it's in reactions that use oxygen. So remember, aerobic respiration, creating lots and lots of ATP. So when the activity of the neurons in the neuroglial cells increases in a particular area of the brain, you've got to increase blood flow to that area as well to deliver more oxygen and more glucose so that more ATP can be created. Even a very, very brief slowing of blood flow to the brain can cause disorientation, cause you to lose consciousness. Very similar to what happens when you stand up too quickly after sitting down for a long period of time. Typically, an interruption in blood flow to the brain for only 1 or 2 minutes can impair the function of the brain, and a total deprivation of oxygen for 4 minutes, only 4 minutes, can cause permanent injury. Virtually no glucose is stored in the brain because we're constantly using that glucose to make ATP. So the supply of glucose has to be continuous. If blood entering the brain has a low glucose level, confusion, convulsions, loss of consciousness, dizziness may all occur. So people that have diabetes mellitus, which of course we know is related to blood sugar, have to be very vigilant about maintaining and watching those blood sugar levels, because those levels can drop very quickly, and when they do, it can lead to a condition called diabetic shock, which can, of course, lead to seizure, coma, and possibly even death. The blood-brain barrier consists of tight junctions that seal together endothelial cells of the capillaries in the brain, and also a thick basement membrane that surrounds those capillaries. In addition to that, we talked about astrocytes, remember, when we were looking at nervous tissue? Those astrocytes are neuroglial cells, and the processes of those press really tightly up against those capillaries, sort of hold on to them, but also secrete chemicals that maintain the tightness of the tight junctions of the blood-brain barrier. So the blood-brain barrier allows some things to get in and out of the blood and to the brain, and prevents other things from doing so. It is very effective, so it prevents the passage of harmful substances, but that also means that sometimes helpful or therapeutic substances can't get across that membrane as well. So by preventing things from moving from the blood into the brain, those drugs may not be able to get in. One new method that's being used, though, is to inject that drug in a very highly concentrated sugar solution. That's going to increase the osmotic pressure of the blood, and when it does, it's going to cause those endothelial cells of the capillaries to shrink a little bit, and the gaps between them open up the tight junctions a little bit. So it makes the blood-brain barrier a little more leaky and allows some of that drug or that therapeutic agent to enter the brain. So as I mentioned, the blood-brain barrier allows some substances in the blood to enter the brain tissue but prevents passage of others. Lipid-soluble substance, including including oxygen, CO2, steroid hormones, alcohol, barbiturates, nicotine, caffeine, and water-soluble molecules can easily cross the blood-brain barrier because they easily diffuse across the lipid bilayer of the cells that make up the layer, right? So across the cell membranes. A few water-soluble substances, though, such as glucose, come across the blood-brain barrier with facilitated transport. So there are glucose transporters that help the glucose to move across the membrane. Other water-soluble substances, such as some of the ions, are transported across the barrier very, very slowly. And then some substances, such as proteins and antibiotic drugs, don't cross the blood-brain barrier and get into the brain tissue. It should be obvious, though, that trauma and certain toxins and inflammation can cause a breakdown of the blood-brain barrier. But then there are some areas that we don't need to have a blood-brain barrier because we basically need to monitor what's going on with the blood and with the brain. So, for instance, if you get food poisoning from something you eat, the vomiting centers in your brain need to be able to detect those toxins and poisons in the body and cause you to vomit to get rid of those contents. Also, the hypothalamus is what we call the monitoring station. So the hypothalamus basically keeps a check on what's in the blood, the concentration of ions and nutrients and other things, and can then direct hormones and other chemical substances to be released. One of the dangers, though, making sure that newborns remain in areas where they're not going to be exposed to certain things that can cause them to be sick, and also one of the reasons that we don't give them certain substances as a part of their food when they're young is because that blood-brain barrier is not fully developed, and because of that, many things that adults would not allow, the blood-brain barrier in adults would not allow to cross, will do so in newborns. Within the brain, there are fluid-filled spaces or cavities that we call ventricles. So the ventricles are filled with cerebrospinal fluid. There's one lateral ventricle in each of the hemispheres of the cerebrum, and you can think of those as ventricle 1 and 2. So these are your lateral ventricles. There's one called the third ventricle. That third ventricle is very narrow, so it's a cavity that's superior or above the hypothalamic area and between the right and left sides of the thalamus. And then it's connected through a tube-like structure called the cerebral aqueduct, so aqueduct, water passage, to the fourth ventricle. The fourth ventricle is between the brain stem and the cerebellum. So all of this blue area you see that looks sort of like the horns of a ram sitting on a stem, all of that is fluid-filled space called the ventricles. So here you have the printed words to go along with what we just talked about. I do want to mention the ependymal cells because we talked about these when we examined the neuroglial cells. So the ependymal cells are going to line the ventricles, and they're going to make and secrete cerebrospinal fluid, but they also have cilia-like projections coming off of them that helps to circulate that cerebrospinal fluid. So let's talk just briefly about cerebrospinal fluid. It is a protective liquid that is going to be held in the fluid-filled spaces called the ventricles. It's going to contain small amounts of oxygen and glucose and other chemicals that are going to move from the blood into the cerebrospinal fluid and, of course, to neurons and neuroglial cells. The cerebrospinal fluid is going to circulate continuously through those ventricles and through the central canal of the spinal cord. It also contains some white blood cells, some ions, of course, sodium, potassium, calcium, magnesium, chloride, bicarbonate ions, and many of the same things that we see in the blood. So it's very similar to blood plasma. The ependymal cells are part of structures called choroid plexuses, which are clusters of capillaries that are going to hang from the ventricles. And it helps the ependymal cells to make and cleanse the cerebrospinal fluid. When excessive cerebrospinal fluid accumulates in the ventricles, the pressure of the cerebrospinal fluid, of course, is going to raise. Elevated CSF, cerebrospinal pressure, causes a condition called hydrocephalus. Hydro meaning water, cepha, head. May not be a very nice term, but that's what the pieces mean. The abnormal accumulation of that cerebrospinal fluid may be due to an obstruction of the flow of the fluid, an abnormal rate of the production of cerebrospinal fluid, or a failure to reabsorb it back into the blood. In a baby, remember, the cranial bones have not fused together, so those fontanelles or soft spots are still present. So that accumulation can cause the head to bulge. If the condition persists, the buildup is going to compress and damage the nervous tissue. Hydrocephalus is usually relieved by draining the excessive cerebrospinal fluid by putting in a shunt. In adults, hydrocephalus may occur because of a head injury or meningitis, a viral or bacterial infection, or a subarachnoid hemorrhage. Sorry, I'm talking so much my words are getting tangled up. But think about the difference in the infant head and the adult skull. So in the adult, of course, we know the bones are fused together, forming those sutures. So when you have an accumulation of cerebrospinal fluid in the adult, those fontanelles are not present, so the head can't bulge or become larger, so that fluid builds up inside that tough, resistant bony structure and can quickly start causing compression that can be life-threatening unless immediate intervention takes place.